Hello, lovely people. My name is Dr. Mona Lisa. I'm the founder of KAC Pharmacy, located at Southside Apartments in Karen N.
And I'm Dr. Linda Opanga, pharmacist, and I'm the host to this channel.
It's so exciting. This is like my third time in your channel. I'm so excited. Oh, so today our topic will be non-adherence to medicine by patients. So yeah, Linda, we've seen in our career, we've seen so many patients, you give them like medicine for 5 days, but they end up taking for 2 days.
2 or 3 days.
So someone might ask themselves, what is non-adherence? So non-adherence is basically if you don't take medicine as expected. That's what we call non-adherence. It could be either days or the timings. So today we'll discuss why do patients suffer from non-adherence.
Some of the factors that cause non-adherence. And today we're going to do this video differently. So with me here, you see she has a ball. So we've written the causes of non-adherence. So she will pick a reason, I will pick a reason, and then we discuss just to make it more friendly and more enjoyable, so that you guys don't log off and don't get bored. So without further ado,
let's start. Let me shake. Let me shake. Let me shake.
Reminds
we don't want it to be rigged. You know. We want it to be a fair play. So
I will start. Oh my God, I hope I've picked something good. So the first one that I've picked is resolution of symptoms. So this happens where let's say let me use antibiotics. So when a patient is put on antibiotics and then you go to the pharmacy, they tell you that these antibiotics are supposed to last for maybe 7 days. And then when someone takes the antibiotics and then they feel better, by day 2 you feel better.
There's a time a patient will come and say, just give me amoxil for 3 days. Meaning that according to him, after 3 days he's already feeling well. And that's very, very, I can say, how can I say it? It's illegal. It's very illegal because you know patients tend to, when their symptoms resolve, when you start taking antibiotics and you feel okay. Most of the people, I can say 80% of the people tend to stop the medication. So that's one of the reasons for non-adherence. The disadvantage of that, you haven't healed the disease completely,
and so then there will emerge resistance.
The resistance is so bad because imagine I give you amoxil, you don't finish the dose, and you keep on doing this for let's say 3 years. There'll be one time you'll get sick and amoxil which would have worked won't work, and you end up spending more money in buying more expensive drugs for you to get healed. So watch out.
So I also want to put out across that this is one of the reasons why we had the super gonorrhea. The super gonorrhea that you've been seeing like going around, it's because of drug resistance, which is caused by non-adherence at the end of the day.
And I talked about it in my TikTok. Guys, follow me on my TikTok. I talked about the common super gonorrhea and how it emerged, and it will talk about this so much. It will talk about the resistance of this disease, and it was due to resistance to medications.
So next point, please. Shake. Okay, pick it.
Okay, let me pick. Let's see what we have. Cultural and religious beliefs. So how does this cause non-adherence? Let me tell you guys, we are raised in different, in Africa we have different cultures, and when you go to some cultures you find that these people will believe, why take this? Sometimes someone might be sick and come to a pharmacy and take some medication. Let's use antibiotics because normally we give antibiotics and but when you reach home, your grandma tells you this is a demonic ritual you are practicing. You're not supposed to take this medicine. So what does this person do? They take for 1 day. When the parents see the medicine, they stop. And that shows non-adherence. Also religious belief. Let's say in Kenya, we have seen this, I don't want to name names, but pastors, they'll be like, if I pray to you and you give me tithe, you don't need medicine. So in short, if you had gone for a pharmacy the previous day, you go to church tomorrow and it tells you don't need this medicine, I'll just put a hand on you and you get healed. Definitely that will cause non-adherence.
True, and you will end up dying. Saying there's this lady who has HIV, like she lives with HIV, and then she went to a pastor, and then the pastor prayed for her, and then since when you're actually adherent to your ARVs, they reach a point where your viral load is suppressed.
Yeah.
So when they do the test, it's
you
like
feel like you're healed.
Yeah, you feel like you're healed. So that was the case. So the pastor told her, like, I've prayed for you and you're okay. And then she stopped the medication. Do you know what? she ended up now being put on the second line, because now the first line, which had suppressed the virus, now could not work anymore, because she had stayed for long, and then she started becoming sick, went back to the hospital, and then she had to put on the second line.
Oh no. So the body became tolerant to the
became
first line. No.
Yeah. So religious beliefs, they affect you a lot.
You know, one thing we always say, I always tell my patient, in Catholic we always say we treat, doctors treat, and then God heals.
Yeah.
A good pastor will tell you, go to hospital, get medical checkup, and then afterwards you can, after you get medicine, we'll pray for God to heal, because definitely God will heal you. But he didn't create doctors for no reason. Ask yourself, when someone tells you don't need medicine, but you can just put a hand on you and miracles do exist. I won't say no, but also we just accept to be treated. If you're not feeling well, your body has a way of telling you you're not feeling well. Accept to be treated, and then you'll be okay.
So next I choose formulations. So an example I gave, bitter medicines. So for instance, we have like medicines that are very, very bitter, to be honest.
You remember when you were young, there was this yellow medicine.
For malaria.
Oh my God.
The trade name, but it was very, very bitter.
It was so bitter.
Yeah, it was so bitter. So if you give a child such bitter medicine, trust me, they will not take. Even as adults.
Even you yourself, if you're given something which is bitter.
And imagine you're supposed to complete the dose. So that's why now pharmacies are coming up now with different formulations. They mask the test so that now it's okay. So but if you look at this, some formulations can make patients not to adhere to their medicines.
So next, shake. So let me,
you've taken two.
So what do I have here? Frequency of administration of medicine. Let me give an example. Some medicines you're supposed to take, like let's say 4 times a day. You are working, and you can imagine you give someone this medicine, you're working from 8 to 8, and this person has to take this medication for every 6 hours. How many people are there? Very few people will adhere. And that's why normally I always tell my patients, put an alarm after every 6 hours, take that capsule, take that tablet. So you find that many patients will end up not adhering to medication because the frequency of administration, sometimes you're told maybe the 6 hours is elapsed at 3 a.m. Who will wake up at 3 a.m. to take the medication? So the best thing I can say, how we can rectify this, just make sure you put an alarm, and after every 6 hours, let's say after every 6 hours, you keep taking the medicine, because it's very important. There's a reason why the formulation said after every 6 hours.
So next, let me shake like her.
Shake.
So side effect of medicines. So I will talk about, like, generally, if you have maybe you're on a medication and then it's giving you like very, very bad side effects. Like for example, you're taking a medicine, I don't want to say the name, but you take a medicine and then you get frequent vomiting. Like you take this medicine, you vomit. You take this medicine, you vomit. You see, at the end of the day, you'll be like, I don't want to take this medicine because every time I take it, I vomit. For example, anti-cancers, anti-cancers usually have that effect of nausea and vomiting. And I've seen in most cases, like I'd say for the case of my dad, actually, my late dad, he refused to take the anti-cancers because they were causing a lot of very, very bad side effects. So he said, I don't want to take this.
Enough is enough.
Enough is enough.
So these are the reasons. Like even some medicines, you can take some antibiotics for tummy, and you find you have this metallic taste. I actually hate that, but since I know I need to take this medicine to the end, I need to. So in short, when you have these symptoms, just be strong, stay strong, because this symptom, you're not the only one who's experiencing, and not everyone will get this side effects. Also remember that. But even if you get these side effects, stay strong and take the medicine.
Also, in relation to side effects, I've had a patient tell me before that they're diabetic. So they told me they don't want to take the diabetes medication because it's making them lose too much weight, and at the end of the day, like her image. You see, like when you grow up, like in this society, especially the old people, you know, the way they grew up is not the same way we grew up. So like this particular patient patient was concerned about how she's losing weight and how the society was viewing her. So the society was like, these days you're losing a lot of weight, what is wrong with you? Like, what's wrong? And you try to explain to this person, like, this is the side effect of this medicine. Then they say, I don't want, ever since I started taking this medicine, I'm becoming very small. People are talking about me, maybe I have HIV or something like that, you see. So such like things, I think, in order to address this, like you as the prescriber to talk to the patient and tell them about like this side effect will present like this, and then address her concerns. Like what I did is I told her, like, at the end of the day, you have to either choose yourself or the society. Yeah, because you see, I explained to her the complications of diabetes and the consequences of her not taking the medication. Like, you can be blind, you can be amputated, all those effects. So when you're actually dispensing medicines to patients and then they raise such concerns,
familiarize them
familiarize them with the effects and tell them how to go about it and talk to them about their concerns.
Because actually many side effects can be rectified. Can be rectified. So it's good to make the patient, even before they take the medicine, it's called, we say, mental preparation, so that the patient can know, oh, if I'm taking this medicine, I'm about to expect I'm going to reduce weight. Don't let the patient experience these things on their own
first. Then they come and complain to you, or most times they will stop taking the medication. They will not even come back to you to tell you that I stopped this medication. And they will present much later when now the disease has gone to an advanced stage, which now rectifying it might not be so easy. So next point.
Shake. So what did I say? Financial status or cost of medicine. This is so obvious. Like, let's say, let me say cancer medication is very expensive. It's very expensive. You find like a patient will be non-adherent to that medicine because you go to hospital, you're told, you know what, you need 200,000 for a cycle. So you imagine someone who doesn't have that amount of money, and that is something which the chemotherapy is something which would have helped this person to get better. So you find the financial status and the cost of the medicine will tend to make the person an adherent. So sometimes we also, one of our mission in pharmacy, is it our mission or vision? We're supposed to give pharmaceutical healthcare the most cost effective. So even if you're in a pharmaceutical sector, a pharmacy, community pharmacy sector, make sure you are in par with the customers. Not, I don't like calling them customers, actually,
like
your patient. Make sure you're in terms with the patient, because if the patient can't afford this and they need to get better, you need to tell them, okay, you can't afford this, but there's this
an alternative
drug.
That's why we have generics at the end of the day. So I will choose next is the disease state. For example, I gave dementia or forgetfulness. So this happens especially to people who suffer from memory loss. Dementia is like memory loss. So it could be a disease, or it could be just you have a busy schedule, then you end up forgetting that you're supposed to take medicines. So for dementia, I'll talk about now the old people. So if you have an old person, most of them usually start having the memory loss, and they might even forget to take the medicines. And remember, these old people usually have multiple diseases, hence they are put on multiple medication. So for example, if they know that you have maybe diabetes, hypertension, whatever heart disease, you need to take different types of medication. So if this person is experiencing memory loss and they do not have someone like a caregiver or a caretaker to take care of them, they will end up forgetting to take their medication. So in this case, in case like you have a busy schedule, again, the way Dr. Mona Lisa said, put an alarm. Like this time I'm supposed to take my medicine. It will actually help you with that. And then for the old people, please make sure that if you have an old parent or whatever, please make sure that they have a caregiver, and explain and explain to the caregiver the frequency of administration of different types of medicine, so that that can be taken care of.
So shake, I forgot it. Shake.
Next
okay,
point.
let me take. Okay. So mine is lack of clear instructions from prescribers. Interesting. So this comes to us. Like if you're a prescriber, make sure, you know, sometimes let me tell you, in a community pharmacy sector, sometimes I can go also, I forget medicine from my pharmacy, I can go to another pharmacy and try to get medicine. You find like if you have so many patients at the line, the pharmacy tends to like, they're just looking at the money, they're looking at the sales. Amoxil, take Amoxil, Flagyl, take Flagyl. They won't tell you nothing. Like normally, even if you're given Flagyl, you're supposed to be told, do not mix it with alcohol. Why? Because of the adverse effect which comes with it. So you find that us as the prescriber, sometimes we forget to tell the patient, and this patient doesn't know. So that sometimes even you're supposed to take a medication in an empty stomach, but you end up, the patient ends up taking it with food because the prescriber didn't describe. So what? How can we rectify? Please, prescribers, make sure you describe fully the drug to the patient. Yay, do the honors.
Thank you. So the next point is fear of dependence on drugs. So for example, I'll give an example of the drugs that act on the central nervous system, that's especially your brain. For example, you find out that if you're given some medicines, antidepressants, they have withdrawal symptoms, some of them. So and people tend to like get addicted to them.
And you feel agitated when you're not taking this drug. You find them, they're very anxious, they're agitated, they are it just gives you some weird effects.
So some people now say like, I don't want to take this medicine because now I will become dependent on this medicine. So fear of now being dependent, like you cannot function with this medicine.
In Kiswahili we say kuchochwa. Watu wanakuwa unakunywa hizo dawa utakreki. Hizi vitu zitakumaliza. So this patient will come back, will be like, hey, I've been told this drug will make me be like a slave to it. So
True, so I don't want to get addicted to it. Yet it's supposed to help your situation. So the fear of dependence, especially the central nervous system acting drugs.
And always remember, medicines are supposed to make you feel better. So shake for me. So psychological issues, e.g. denial in HIV. Psychological issues. Oh my God. So you know that this will bring an adherence. Let's say, may can bring in a setup, let's say you have stress or something has happened to you, you've been taking this medication, you'll find this person will be like, I don't want to take it anymore, I don't want to take it anymore. So when you're not in a right mental health, you tend to give out, and you'll be like, why do I need this medicine? Even let's take an example of HIV patients. HIV patients would be like, sometimes they'll feel like this world is coming to an end, I have to take this medicine for the rest of my life. What will end up, they'll end up not taking the medicine, so that they just feel like a normal person. And at the end of the day, it's not like you're abnormal, but if you have a condition and you're supposed to take some medicine, you're not different from other people. You're just taking this medicine to make you feel better.
So I was saying, in case of HIV, for example, you're newly diagnosed with HIV, or let's say cancer, or let's say any chronic disease. So like you've been diagnosed and then you're in denial. Like, I don't think I have this disease. I think the doctor was lying. I think the doctor was lying. I think I'm not one of those people who can get this disease. So just go to that stage of denial. And during this stage of denial, when you're not taking your medication, the disease is still spreading. For instance, I've been diagnosed with HIV, and then I go to that state of denial, like, how did I get it? How come it's me? Why me? You know, that phase of denial before you come to acceptance. So like I might go to hospital, then they tell me, I've diagnosed you with this, you'll have to start taking this medication. But then when I go back home, I'm like,
when you reach home, you have that feeling,
like,
I might get better.
I might get better, or maybe the results were just not accurate, or something like that. Then you end up going to another hospital to take a test. It's still positive, and then you're still in denial. So I've seen such cases, and denial is a real thing that causes non-adherence. And remember, the more you deny, the more the disease spreads, and you're causing more harm to your body than good. So it's good, from you seek like psychosocial therapy, so that it helps you now during that acceptance stage. When you move from denial to acceptance, then you can be able to now take your medicines well. So
2 remaining.
Next point. It's you to choose.
It's me. pill burden or many medicine. Oh yeah, you find that these chronic diseases, you have been diagnosed with cancer, you have hypertension, you have high blood sugar levels. You find like this type of patients might even take like 7 or 8 different types of pills, and this burden is so much. I always feel them, and they feel like, you know, this will cost non-adherence, the medication, because it's so tiring. You can imagine every morning, afternoon and evening you're supposed to take like, let's say 11 pills. So this pill burden, I feel it for the patients. Sometimes you don't know what to say, because there's no way you can tell this patient that
like stop this
we
medication.
can just take 7. So this pill burden, so how we can rectify this is just giving hope to these people, to these patients, and tell them that, oh, it's okay and you can do this, and also make them remember that you're always taking medicine to make you feel better.
And then also another way of reducing the pill burden is, now this goes out to the pharmacist. There's something called MTM, medication therapeutic management. So this is where it's a practice in pharmacy whereby now it targets majorly the people with many chronic diseases, people with chronic diseases who are on many medications. Because also remember, these people on chronic medications will try to seek alternative form of medication. So some of them will go the herbal way, some of them will, so you find out that at the end of the day this person is taking so many medication. So you as the pharmacist, if someone comes to you at the point of your pharmacy and they have like many medicines, it's up to you to now take this patient through like counseling, and then at the end of the day you'll realize even they're taking medicines that contain the same ingredient. For example, sometimes you can find out that medicines for their heart failure and medicines for blood pressure, some of them contain essentially like the same thing. So it's upon now you as the patient come to the pharmacy, and you as the pharmacist talk to the patient and make sure you reduce, like you taper down, like not taper down the dose, you just actually help them to reduce the medicines that are actually repeating themselves. So that's why there's MTM that's coming up. And and
I've also remember the point, the beauty of pharmaceutical technology. Nowadays we have medicines which are combined. Let's say like urinary tract infection, I don't need to give this and that. You can even always get a medicine which has
maybe
both combined
3 drugs in one, 2 drugs in one. That will reduce the pill burden. So as a prescriber, make sure please you actually prescribe that medicine that will not cause pill burden to the patient. And also I've seen something that is coming up which is called pharmacogenomics, where now people study your genes, and I've interacted with someone who's actually practicing that in the US. So she's actually coming up with some other project on pharmacogenomics, and she's talking about now the way they tailor medicines based on
your genetics,
you as a patient. So they study your genomic
what's best
sequence,
for you,
and then they give what's best for you, and they're targeting like this patient on chronic medication. Those ones are the ones that they're targeting first. So this will actually help with this pill burden thing. So last point. We have different routes of administration and preferences by patient. So has a patient ever come to you and told you, daktari, mimi nataka sindano tu, like I don't want to take pills? Like some people prefer like injection to tablets, other people prefer tablets
but
to
someone they hear injections. Oh my god.
What is
that? I don't know why I'm forgetting this medical term we call people who fear injections. We'll check it out. She will write it down there.
Whatever it's called.
There's a phobia of not liking needle fear. I've forgotten the name. Some patient will be like, and there's some medicine like you can't give oral penicillin. Penicillin has to be IV. So some will be like, hey, sindano. Doctor, even they will run. Let me tell you, my mom. Sorry, mom.
Time for exposure.
My mom, I remember when she used to tell us, she goes to like a consultant. The consultant will be like, oh, so you need to take like 3 injections. You know what my mom used to do? My mom will say, let me go to the washroom and come back, and that will be the last,
the end
of her in that hospital. So you see, like her, I can say at that point she was very non-adherent when it comes to needles.
True.
Mommy, hi.
It's true. So yeah, that marks the end of our discussion. And guys, if you know any ways that you've been an adherent, what has caused you to be an adherent to medicine,
put them in the comments.
Please let us know in the comment section.
So for any medication needs, prescription processing, beauty needs, well-being, you can contact me. My social media handles, she will describe them at the end there. And KC Pharmacy, we deliver countrywide. Feel free to WhatsApp me. I'm very, very, very available. And yeah, it's been a journey. I'm happy. This is like our third video together. It's such an honor. It's such an honor for me to be here. And guys, watch all her videos. She's very. She has very how can I say, educative content. And I like listening to her because you learn something. And in the world, we need to be open to learn. And in her channel, you'll learn a lot. Thank you for having me so much. And I hope I'll see you next time.
Thank you.
We need to do more videos.
Yeah, we will. Sure, you'll see her face more. So thank you so much, guys. Please, if you have any questions, leave them in the comment section. And thank you so much.
Thank you. See you next time.
I'll see you on my next video next week. Bye bye.